respected faculties and students. Myself, PARMAR SMIT. I am in second year Bachelor of Physiotherapy from Marwadi University, Rajkot. So today is my rubrics to video presentation and our subject is Psychiatry. In Psychiatry, our topic is opioid abuse. So let's start first with introduction. Opioid abuse or opioid use disorder is a chronic relapsing brain disease defined by the compulsive use of opioids despite severe negative consequences. In psychiatry, it is viewed as a complex medical condition that alters the brain's reward system, requiring comprehensive evidence-based medication and behavioral therapies. Opioid abuse is usually discussed under the diagnosis opioid use disorder. It refers to a pattern of problematic use of opioids that leads to clinically significant impairment or distress. What are opioids? Opioids are a group of drugs that act on opioid receptors in the brain to reduce pain and can also produce euphoria. They include prescription painkillers like morphine, oxycodone, codeine, fentanyl, illegal opioids like heroin. Diagnosis. Psychiatrists use the criteria from the Diagnostic and Statistical Manual of Mental Disorder DSM-5-TR to diagnose opioid use disorder. A diagnosis requires at least 2 of the following symptoms occurring within a 12-month period. Impaired control, taking larger amounts that intended or struggling to cut down. Preoccupation, spending a great deal of time obtaining, using or recovering from the drug. Craving, experiencing an intense, overpowering urge to use opioids. Social occupational impairment, feeling to feel full obligation at work, school or home. Physical dependence, developing a tolerance, needing more for the same effect, for experiencing withdrawal symptoms, use of stops. How psychiatry define opioid abuse? Psychiatrists uses criteria from diagnostic systems like DSM-5. Opioid use disorder includes behavioral such as taking larger amounts of longer duration than intended, unsuccessful attempts to cut down, strong cravings for opioids, failure in work, school or social roles, continued use despite physical or psychological harm, tolerance needing more for same effect, withdrawal symptoms when stopping. Opioid mania affects both brain function and mental health, leading to depression and anxiety, cognitive impairment, increased risk of suicide, social and occupational dysfunction. It is treated as a chronic relapsing brain disorder, not just bad behavior. Treatment approaches. Successful psychiatric treatment of opioid use disorder requires a combination of medication and psychological and psychosocial support. Medication for opioid use disorder. This is the gold standard of care. Options include methadone, a full agonist that prevents withdrawal and reduce cravings. Buprenorphine, a partial agonist that blunts the effects of other opioids and manages cravings. Naltrexone, an antagonist that blocks the effects of opioids. Psychotherapies, behavioral intervention are essential to complement medication and address the psychological drivers of addiction. Cognitive behavioral therapy helps patients identify triggers, manage stress, and develop coping skills. Motivational interviewing helps resolve ambivalence and builds intrinsic motivation to change. Contagious management provides tingling reward for negative drug screenings. replace prevention therapy like body is weak or lame, vomiting, cold or clammy skin, blue lips or fingernails, pinpoint pupils. These are the signs of opioid overdose, including rehabilitation and support, detox programs, short-term withdrawal management, long-term recovery programs, support groups, example, Narcotics Anonymous. Withdrawal symptoms important in psychiatry. When opioids are stopped, muscle pain, cramps, anxiety, irritability, sweating, whining, diarrhea, nausea, insomnia, not usually life-threatening but very distressing and a major reason for relapse. Key psychiatric idea. Modern psychiatric views opioid abuse as a brain-based addiction disorder involving reward pathways, learning and stress system, not just a moral issue. So this is all about of opioid abuse. I hope you can understand easily and clearly. Thank you.